I'm really proud to announce the fact that we are delivering the COVID vaccine programme for our local population as a vaccination centre from Darlaston Health Centre. We are the first group of GP practices to be doing that for Walsall patients. We have invited in some of our most vulnerable group of patients, aged 80 and above.
We've been through a pandemic for the last 10 months and people have had very challenging times. And as we see that there is something there for people to look forward to next year, I think the vaccine is the best possible thing that have come as a Christmas present, especially for the whole community at this particular time.
I haven't seen my son since January because he lives in Mid Wales with his family. So he hasn't been, and they haven't been able to come and visit me, and I've been isolated, I live on my own. So it has been a bit difficult for me. But I'm saying that there's thousands or a lot more in the same position of what I am. So, you're grateful for what you've got and make the best of what you've got.
It's really exciting. We're providing a really useful, good service. The best thing that we can possibly do is vaccinate these people so as we can get COVID sorted and get back to normal life.
It'll be safe to be taken. We have the one dose and then you come back for your second dose. Please wait for your invite from your general practice and that will come to you shortly. It has been a challenge because this is a completely new vaccine within general practice that we'll be using, so we've had to do a lot of training for it to make sure that we deliver it safely. The vaccine itself is very difficult to store, as you've probably heard. It comes frozen and then we get it delivered to us when it's defrosted. We have to have tight control of the fridges. And then we have to deliver it within 5 days of having received it. So it's a big programme to get the number of doses done so we don't waste this precious vaccine. So it has been difficult because obviously we are running, general practices are open as usual to help look after our patients. And as I'm a working GP as well, I've had to take time out of my normal roles to do this. But this is where teamwork comes in. We all work together to make sure that we deliver what we need to do for our local population. I wanted to really thank the team that have helped develop this COVID vaccine programme. There's been a lot of behind the scenes work done by so many groups of practice. We've had 6 practices involved in this, dedicating their time and their staff members to do this. We've also had the CCG help us, and obviously we've got NHS England working in the background to help deliver this vaccine. So there are a lot of thanks to go out to a lot of different people.
And we've all worked incredibly well as a team. Doctors, nurses, pharmacists, healthcare assistants. Been really exciting. We've risen to the challenge and we are actually ready to deliver the programme.
Any vaccine can cause a side effect, is the first thing to say. And even our flu vaccines that we give every year can cause some localised soreness, some irritation, some mild fever symptoms, which would generally settle within 24 hours with the use of simple things like paracetamol. And the COVID vaccine is no exception in this. But you're right, what we've been hearing in the news is of severe allergic reactions. And again, this can happen with any vaccine. Now, from what we've heard so far, there are 4 patients who have suffered these adverse effects. Each have been managed at the time, and they have been managed in a normal hospital ward and they've been discharged home within 24 hours, fully healthy and well. Now, if we just think back to how many COVID vaccines have been given over the last few days across the UK, we're talking about 4 out of some 10,000 patients that have had this reaction. This is a very small number indeed. We're advising people that have severe allergic reactions who might need an EpiPen, that perhaps at this point in time the COVID vaccine is not for them, but for the other patients, then we are very happy to proceed. We have the equipment and the kit ready. If something goes wrong, we hope it doesn't. It probably won't, but we will look after you.
So it's an inactivated vaccine, so we're not actually giving you the virus. We cannot give you the virus with the vaccine. However, it will teach your immune system how to react should you come into contact with it to keep you healthy.
Yeah, most common side effect really is you're probably going to get a sore arm. Can go a bit red and lumpy. You may get a bit of a temperature. which should go down really within a few days. That's if you get it at all. You must stay for 15 minutes after having the vaccine, just in case you do get a reaction.
Once you've had your first dose, you still need to be cautious of the vaccine, and then you will have a second dose. Even then, we still need to be cautious, but it's good that the vaccine is giving you some level of immunity. It's still important to be wearing your face masks when you're in company, and also keeping your distance and using the hand hygiene as usual. So it's that the face, space, hands.
I would request and appeal to everybody to have it. That is the only way forward for us to have a good, decent Christmas, looking forward to holidays next year, for the children to go back, enjoy the friends, schools, family life.
Without you lot, the national health and all your good help and doing, we could not manage without you.